Hi everyone, Dr. Amy from Pain Free and Fit. Today we're going to be talking about how backwards walking can be used to improve multifidus and other extensor muscle activities that help to reduce and prevent pain associated with lower back disc herniations, bulges, and disc degeneration. Hope you enjoy. So today's tip is right out of my new book, Walk Away Back Pain. It focuses on a walking technique that can be used to help relieve pain due to disc herniation in the lower back, disc bulges, and even disc degeneration. What we're going to be talking about is how to engage the spinal extensor muscles with backwards walking. Now, if you've seen any of our other videos on the channel associated with disc problems and healing exercises for them, you realize that central to a lot of disc problems is disc problems are aggravated with spinal flexion. When we slump forward, when we bend forward, the vertebrae compress on the anterior front aspect, and that's where the disc is located. So when you increase that compression, it many times drives the inner part of the disc, called the nucleus, backwards, aggravating herniation, bulges, and even disc degeneration. And central to lower back rehabilitation is spinal extension, learning how to, as opposed to bend the spine forward with a lot of abdominal work that bends forward, rather learning how to extend or increase or maintain the arch in the back to avoid flexion, to avoid that compression. Central to this is a small muscle that comes off the bones in the middle of the spine called the multifidus. They run from the bony knobs in your spine called the spinous processes and come down and out several levels. These muscles are extensors. They help to bend the spine upwards or increase the arch in the lower back. But unfortunately, many people with disc problems, whether it's bulges, herniations, or even degeneration, have weak or atrophied multifidus muscles, either on one side at one level or multiple levels or even both sides. In fact, when multifidus muscles atrophy or shrink down or become weak, they many times also lead to fat being replaced in the area where the muscle was. As muscle shrinks down, the body lays down fat in that area. It's not that fat is replacing muscle tissue, it's not that muscle turns into fat, but in that area, fatty infiltration happens. And this can be shown on MRIs, and it's a common finding with a lot of people with disc problems. Multifidus muscles have shrunk, and fatty infiltration has taken in or has increased in size in the area. We also know through research that the more fatty infiltration you have with multifidus atrophy, the longer your symptoms are of back disc problems. And we also know that backwards walking has been associated with greater multifidus contraction. So it's a way of self-rehabbing or taking a self-management approach to your back pain that increases the activity of multifidus, helps to build them up, helps to strengthen them, and helps to rehabilitate your spine. So why is this so? Well, when we walk forward, although we do use some degree of core muscles, including the multifidus, we don't nearly use the same amount as when we walk backwards, because as we step backwards, two things happen. Number one, as I step back, my body doesn't know exactly what's behind it. Even if I peek behind, I'm a little unsure. So one of the natural reactions of the body when it's unsure where it is and needs what's called extra proprioceptive input, which is knowing where it is in its environment, the core muscles will contract because they sense a little bit of hesitancy or danger. So besides the multifidus, the deep abdominal muscles like the transverse abdominis, the rectus, all the core muscles will contract a little bit more when we walk backwards. But in particular, the extensors, the multifidus muscles and even the erector spinae muscles that run up and down about an inch off the sides of the spine become more activated because the motion of walking backwards elevates our heel. And as our heel elevates and we put pressure on that toe, it's as if we're walking in a high-heeled shoe. And one thing you'll notice about high-heeled shoes is they tilt the pelvis forward. They cause an anterior pelvic tilt. That increases the arch of the lower back. That engages the extensors to hold that arch. And that's why walking backwards, those two reasons, allow the multifidus to contract harder. And you can feel this on yourself. If you put your fingers, your thumbs, on any of those bony knobs in your lower back, go to the bottom, right, and left corners of any of those knobs, and if you walk forward, you may notice a little bit of tension in those knobs, but as you walk backwards, you'll notice those knobs or that muscle tension increases compared to walking forward. So you can use this. Now, you don't need to walk backwards for miles, but on your fitness walks during the day around home, put in a few minutes here and there of starting to walk backwards. It's a nice, easy, gradual way to build up the length of time and the duration or the distance that you use this technique with, and little by little your multifidus muscles will start to engage more. Now we have other videos on the channel that talk about targeting one particular multifidus that's weak and learning how to activate that multifidus. Check them out. We got a lot of great videos. Subscribe to our channel if you want to learn more videos about exercise and lower back pain. If you'd like to help me share this valuable information with others, give me a thumbs up below. Questions or comments, as always, I'll do my best to answer them. And remember, if you're looking for a great walking program that not only has backwards walking, but hundreds of tips and walking exercises while you're walking to self-rehabilitate back pain, whether you have disc degeneration, herniation, bulges, or any other type of low back pain, check out our Walk Away Back Pain program. It's a new book. We even have a whole program based on it that you can subscribe to on a monthly basis that helps you develop your back in terms of fitness, self-rehabilitation, learning to strengthen what's weak in your back, learning how to relax what's tight in your back, learning how to improve your mechanics in terms of your movement, your spinal stability, how to engage all the different muscles that help to support spine stability and reduce back pain. That's Walk Away Back Pain, available at painfreeandfit.com. I hope this video on backwards walking and multifidus muscle activation for disc problems helps you with your chronic disc herniation, bulges, and degeneration.